Good afternoon. I'm Brooks Brunke from Beckley, West Virginia, and today we're going over the uses and reasons why you choose a tourniquet over your traditional wraps or even gauze for extremity wounds. Now, the reason you'd pick a tourniquet over, say, some gauze and an ace wrap is for major bleeding from one of the extremities. You'll notice major bleeding by bright red blood. It could even be spurting from the wound. That's how you know that's an arterial bleed, and that needs to be stopped immediately. Now, you don't see any of this. You've seen the person actually get injured, and you see that it's just a minor scrape, or that there's no bright red blood, or that it's spurting. You can use gauze and an ace wrap, and that's going to take care of that wound. Now, to do that, we're going to find the area that's affected. Say this volunteer has some cuts on his forearm in this area. We're going to get our gauze out. We're going to find the end, and we're going to lightly wrap around the affected area. You don't want to make it too tight because you don't want to cut off blood to that area. You just want to have it tight enough to where it's putting pressure on the wound. So we're going to wrap this around it. And you want to make sure you cover the whole wound with the gauze. Now, you're going to take your ace wrap, and we're going to do the same thing. We're going to try and cover up all the white of the gauze. That's going to help keep it clean and keep it really just keep the dirt out until you get to a medical professional to actually help. So we're going to go up the arm, covering all of the gauze. And again, we don't want to put it too tight. We're not trying to make a tourniquet on this type of wound. Then we're going to go back down. So with a small wound like this, this is really all you have to do. You're not going to need to get a tourniquet. You're not really needing to worry too much because it's contained. You've got it secured. This ace wrap's putting pressure on it, and that's going to stop the bleeding. Now, say this person had a more deep cut that's spurting. You're seeing the bright red blood. That's when we're going to need to stop that bleeding immediately. To do that, we're going to take our tourniquet, and we're going to put one end of the strap through the top loop of the friction band. We're going to slide that up as high as we can on their arm. We're going to pull it tight while holding onto that friction band. And we're going to wrap it around and connect it back on itself with the Velcro. At this point, we're going to grab our windlass rod, and we're going to turn it at least 3 times. That should be more than enough to cut off the blood flow to most adults. Now, again, since he's not in danger, we're only going to do it the one time, just so it's secured. So once we've got our windlass rod secured in our tourniquet, there's a little piece of tape that holds it secure that we write the time on. Now the time is very important. Is that too tight? Okay. The time's really important because you don't want to leave a tourniquet on for more than 6 hours. Anything after the 6-hour mark is when you're going to start getting death of tissue, and they're going to have permanent damage in that limb. So that's when, if you're having to put a tourniquet on, you need to get them to a medical provider immediately. There's really no time to wait around. So a couple other things with a tourniquet. You place them a little bit differently when you have, say, a leg wound. Now you'll notice that the friction band has 2 holes. Okay? When you're doing an arm, you just put it through the one and you come back on itself. Now say we have a leg injury, say he's bleeding somewhere on his leg, while you're getting your tourniquet ready, You're going to place your knee right here in their groin, right on that femoral artery, and that's going to stop the blood to the leg while you're fiddling with your tourniquet. So, we take it, we're not going to strap it yet. We're going to come under the leg, get it up as high as we can. We're going to place it through that back part of the friction band, and we're going to come back through and go through that other band. Now for these, they need to be pretty tight before you even start to turn them. So you're going to grab the end, and you're going to grab the windlass rod. You're going to pull them as tight as you can. And again, same with the upper extremities. We're going to turn it at least 3 times. But really what you're checking for is to make sure you can't get any fingers between the tourniquet and their skin. That's how you know it's tight enough. All right. So, in conclusion, you don't want to use a tourniquet for every injury you see on an extremity, just the ones with major bleeding. And that's bright red blood, sometimes spurting. And for everything else, you want to use as minimal equipment as you can. Your ACE wraps and your gauze. Thank you.